The rapid rise in COVID-19 cases is leading to yet another social challenge. That is a severe shortage in labour as infection keeps workers, including those in essential services, quarantined at home. For more, I have Professor Kim Eun-gyu from Yonsei University. Professor Kim, it's a pleasure to have you back.
Great to be here again.
I also have Professor Kim Se-wan from Ewha Women's University. Professor Kim, it's good to see you too.
Thank you for having me.
Professor Kim, first then, how has Omicron infection among healthcare workers affected the medical arena?
My personal experience, I used to see one case a month, then one case a week, and every case a day. Then we are seeing cases every shift, so that means it's strikingly increasing. And we have a cohort control study from Portugal. They studied with the Wuhan original strain, and they concluded that it's about 2 times higher risk for health professionals to get infected. And it's going to be much higher for Omicron. So many medical personnel are getting Omicron infection, and it results in a chain of reaction. The person has to get quarantined, and the colleagues have to get quarantined for a while. And it results in a big burden for all departments, all teams. There are delay in operation, procedures, and outpatient clinics. And there are obstacles delivering proper medical service on time because we have to add on some procedures like checking the PCR results and disinfecting all those areas. So I'm now receiving a lot of frustrated phone calls from the parents because I work in emergency department, and but most of the hospitals are already satisfied, especially children, and I feel very sorry for them.
Right. And from an economic perspective, Professor Kim Se-wan, what can you tell us about the overall shortage in labour owing to Omicron infection, not simply here in the country, but across the globe?
Well, skyrocketing Omicron infection dismantles labor markets of US and European countries. But in Korea, the fast rising Omicron does not affect Korean economy in a full scale yet. According to US government, about 8.8 million US workers, or 6% of total workers, did not work in January because they are either infected or taking care of infected families. So that problem, that decrease of the labor, create really a serious chain reactions of higher wages and prices of all goods and services, and shortages of all goods and services, and lastly, inflation of the US economy. So almost the same situation is developing in European countries too. But relatively speaking, Korean companies are doing well by enforcing emergency plans that hires retired workers of separating Omicron-infected workers quickly.
Right. And talking about emergency plans, Professor Kim Eun-gyu, I understand authorities here have in place a mechanism to ensure operations proceed smoothly within the medical arena and that they're not disrupted, even amid a surge in Omicron infections. Do tell us a bit more about this.
Yes, we received an official letter from the public health authorities that we should make a business continuity plan. And personally, it was my first time I had to make those plans. And according to that plan, since we have more than 50,000 cases right now, medical personnel who's infected could return to work after 3 days if the rapid antigen kit test is negative. But this is an extremely risky policy. Relying on a rapid antigen test for negative result is something we don't want to do.
Right. Is that why most medical centers are reluctant to implement these guidelines?
There's a reason we are reluctant, because the credibility of rapid antigen test is not that enough to most of the hospitals. We have to care for sick, very weak, and we don't want to spread those infections to them.
Of course not. I understand this may be a difficult question, Professor Kim, but do you have an alternative suggestion, perhaps, then, to ensure that operations within the medical arena proceed smoothly, even amid the surge in Omicron?
Every time the government gives out some message, I have to go back to my hospital and talk with the persons who are responsible. And usually the final conclusion is we should be very conservative. And already I had to close down my department a few times because my colleagues got infected. Rapid antigen test kit is not suitable for medical personnel. We confirm PCR negative for return of those confirmed cases, mostly because we want to protect the patients. And if you are still positive after 7 days of quarantine, you cannot return back to work. I had to check PCR twice when my colleague was infected. And there's another issue that how can we define the infectivity of those results? Sometimes it's been months you got infected. You should not be. You should be free of virus, but sometimes we have positive results from PCR. So we have to decide whether this is a reinfection or repositive. So many problems we have to solve, but my word is hospitals has to be conservative and very cautious in this issue.
Right. And back on the economic front, Professor Kim Se-wan, do tell us a bit about the economic repercussions of a severe shortage in the workforce as a result of rampant infection.
Well, if Omicron situation in Korea goes like today's, we can have a serious shortages of labor and all goods and services like that of the United States. I would say the number of infections per day exceed 100,000, and the total size of infected workers exceed about 5% of total workers, or 1.4 million. We would have almost the same situation as United States and European countries. And again, this situation generates a long chain reaction of higher inflation and wages increase and shortages of almost all indispensable goods and services. So if that happens, there could be a panic buying from general citizens, and there could be a downward adjustment of this year's economic growth, where government's targeted 3%, but that could be seriously downward reshaped.
Right. Separately speaking, Professor Kim, business hours at drinking and dining establishments were recently extended by an hour to 10 p.m. from 9 p.m. Now, do you see this extension perhaps as having a tangible impact on business profits for these small business owners?
Well, I think that is the tough question, Sunny, because government and small business owners are not saying the same thing about the impact of the extended business hours to 10 p.m. Government has decided to extend business hours to 10 p.m. from previous 9 p.m. And that is a very difficult decision to make, because government knows that the Omicron situation is no good at all. But on the other side, small business owners and self-employers are arguing that without extending business hours to midnight, for example, there won't be any positive impacts from extending business hours. So personally, I believe that 1 hour extension of business hours should have some marginal impacts, positive marginal impacts on small business owners like restaurants, hotels, and coffee shops, and so on. But that is, as of now, not enough for the businesses of small business owners.
Right. And staying with social restrictions, Professor Kim Moon-gyu, Daegu's district court has denounced vaccine requirements at restaurants and cafes for those below 60. How do you respond to this latest development as Korea seeks to fight Omicron?
Vaccine pass should be applied to encourage vaccination. And it's better than making a lockdown. And it worked well with the original Wuhan strain. But now it's a totally different situation. And it is very tricky because vaccine does not completely prevent infection. It just lowers the risk of getting severely ill or having mortality. If we stop doing the epidemiologic investigation, one of the rationale of vaccine pass is gone. And the effectiveness of this vaccination pass is not that good as before. So now we still need to wear mask and hand hygiene and keep distancing. And think one more time when you are getting off the mask, because we have to keep some basic rules to fight against this Omicron outbreak.
Right, we do. Moving forward, Professor Kim, what would you highlight as the potential variables to economic growth here in the country post-pandemic?
When we go back to the normal situation after the end of pandemic, of course, economic recovery will be faster than that of the COVID period. But what we know from the last 2 years' experience is that Korean economic structure and people's behaviors and attitude have been significantly changed. That provides actually both of challenges and opportunities to Korean economy and businesses. For example, economic is reconstructed by adopting lots of online business technologies and delivery businesses these days through smartphone. And also, people's attitudes and behaviors have been changed because they want to maintain certain level of quarantine after going back to the normal. Like people will be wearing face mask even after the pandemic, and they want to keep a certain distance from other people after pandemic. So this is new situation and new challenges for Korean economy and companies.
Right, they are. And Professor Kim Moon-gyu, speaking within your capacity as a medical expert then, what do you propose to ensure a balance between public health and economic stability amid the presence of Omicron?
It's just like a situation you want to kill two birds with one stone. And I think it's time to forget about all the success we made during the previous 2 years of outbreak. Now it's a new start, and it's Omicron. And but now we have vaccine, we have Paxlovid, like a medication, and we have also experiences. We know better than the previous times. And it's time to change the strategy. I mean, we try to lower the total case of COVID-19, but we have to change to prevent fatalities among people, focusing on high-risk group. And now we have to include infants, because we are encountering many news that children less than 12 months of age are getting mortalities. And we still need to continue the vaccine campaign, since we started to give Novavax as a lower side effect, and which is very promising. And yes, I think we have to ease the restrictions to, for economy and education, but I hope that we might postpone that easing for a couple of weeks. Since I'm monitoring all the data of the big countries worldwide, and I feel like after the start of Omicron outbreak, it takes about 4 weeks, and then they reach the top and start to decline by itself. So I think Korea needs a few more weeks to reach the top. And one thing different from other countries is in the general population, the natural infection rate should be very low, because we did a good job during those 2 years if we compare to United States or UK or other European countries. So it might take a little bit more, a few weeks. So I wish that we can ease the restrictions after those critical times.
Right, I hope so too. And lastly, Professor Kim Se-won, Russia's brutal campaign in Ukraine is bound to have consequences for the world as a whole. That being said, what are the ramifications that Korea may witness in the near future?
Even though Ukraine is far away from Korean Peninsula, it does have huge impact on Korean economy. Russia's invasion into Ukraine worsens ongoing many problems in global economy, like inflation, global production chain disruptions, and oil prices. particularly related to oil prices. It is lingering as of now around $90 per barrel for a while. But if the oil price exceeds $100 per barrel, it does have a big impact on Korean economy. Actually, Korea is one of the most oil-dependent countries in the whole world. The personal oil consumption is one of the largest in the world, right after United States. So if that high oil price goes on over $100, we believe that the economic growth of Korean economy for this year will be shrink by 0.3% at least. And in addition, if oil price goes up beyond $120 per barrel, economic growth will be further shrink by 0.4% for this year. So Ukraine's geopolitical issue is a really big issue to Korean economy too.
Right. Hopefully there will be a quick settlement on that front then. Professor Kim, thank you very much for being with us today. Professor Kim and you, right, thank you for being with us as well.
Thank you.